So again, welcome. Thank you so much for coming, and welcome to our second annual Black Maternal Health Summit commemorating Black Maternal Health Week. My name is Reverend Dr. Q English, and I'm honored to serve as the director for the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services under the leadership of the Honorable Javier Becerra. At this time, I want to ask my colleague and a person that is doing amazing work and has been for many, many years here at Health and Human Services to improve maternal health outcomes in our nation. So let us put our hands together for Karen Marks, the Director of Strategic Partnership at Intergovernmental and External Affairs Department.
Good morning, everyone, and all credit goes to Q for putting together such an amazing summit today, where we are happy that she has spent so much time and effort really tackling this issue and cause with us. Earlier this week, the administration released a proclamation on Black Maternal Health Week, where the President and Vice President recommitted to ending the maternal health crisis. This year, the recently passed omnibus bill included over $100 million in funding for Black maternal health priorities, and our President's fiscal year 2025 budget proposal included $376 million for key programs focused on maternal mortality and maternal health equity. Through these financial investments and the actions that HHS and the administration have taken, we continue to address the unacceptable disparities and high mortality rates in maternal health outcomes. Most significantly, we are thrilled that 45 states plus DC and the U.S. Virgin Islands have extended postpartum Medicaid coverage from 60 days to a year, and we hope those remaining states will continue doing so. We've also taken action to bolster and launch the Maternal Mental Health Hotline, 1-833-TLC-MAMA, for everybody to share. To further fund and support health centers in underserved communities, to conduct research to reduce the preventable deaths and causes of maternal death, to bolster our data collection, and to identify and highlight hospitals that are birthing friendly. Most recently, we're spending a lot of our time thinking about how to better support women in the postpartum period, from addressing behavioral health concerns, access to and transitions of care, and focusing on how to address the accompanying social drivers that make it so hard for women to care for themselves and their families. As Q and I both sit in the Office of Intergovernmental and External Affairs, it is our job, but also our privilege, to be able to connect and interact with external stakeholders and collaborators like yourselves. I want everyone here to know that we are listening to you all. We want to center the experience of those that are giving birth and to develop the policies to address the challenges and barriers that people are facing. And much like giving birth and raising a family, we need to partner together and form a community to do so. I look forward to continuing to work with you all to continue this mission to help make birth a more joyous and respectful experience for everyone. And with that, we are going to turn it to a video. Thank you all.
Being a mom is everything to me. It is truly the most amazing feeling in the world to have someone that depends on you and someone that loves you unconditionally, that you can love unconditionally. I want to share my story to help other women speak up and be heard. My daughter is 6 years old and she's sassy. When I first found out I was pregnant with Peyton, I was extremely excited. It was one of the happiest moments of my life to know that I would be bringing a little person into the world. I had one of the worst pregnancies ever. My symptoms started around 2 months. It was fairly early in my pregnancy, so I had a long time to have a very tough pregnancy. I didn't have what I needed, the tools. I didn't know who to talk to or how to speak up for myself. I would have a lot of pain that I just couldn't explain. Because it was my first pregnancy, I always assumed that it was just normal, and everyone tells you every pregnancy is different, so you just assume that as part of pregnancy, your body's changing. You're going through so many different changes that you're not aware of or something you've never been through before, so you just assume maybe it comes with the territory. I talked to a lot of different people. I tried to talk to my doctor. I even talked to my primary care physician, who's not even my OB, just to get information. Did a lot of research and a lot of Googling. I was scared. I was scared a lot of the time because I just felt like no one heard me. I was having headaches. I would be dizzy a lot. I would experience a lot of pain. And I just knew things weren't normal. My primary care doctor advocated for me a lot to switch my doctor. Had it not been for my primary care physician pushing and advocating for me, and even, friends and family, a lot of people just said that it's not normal, and if you feel that something is wrong, then there more than likely is something wrong. It's extremely important to hear women because you don't know what they're feeling, but they do. Hear her.
So what you just witnessed was the power of storytelling. Thanks to CDC, this is part of their Hear Her campaign. And through this storytelling, we immediately connected. And for some, it was a relatable story with the lesson attached. We learned, and for some, it moved that empathy needle. I know it does for me. And so when we think about ways of engagement, ways to elevate the message we're trying to convey as it relates to improving maternal health in our Black communities, use storytelling. Make it culturally relevant, culturally sensitive, and embrace cultural humility. And it's a powerful tool to move people from compassion into action. And simply sharing these stories on social media, in houses of worship, group gatherings, it's a great conversation starter. Many have asked me, how do we start? This is one way. And it has the power to increase awareness and move others to action. So remember the power of storytelling. To that end, I am excited about introducing our fireside chat. Participants joining us is Dr. Nima Sheth, Associate Administrator for Women's Services, Substance Abuse, and Mental Health Services. She'll be moderating the panel today. We have Nicole Barnett, Alexia Dumbuya, CEO of CocoLife.Black, and Bruce McIntyre, the CEO of Save a Rose Foundation. Let's give them a hand as they come.
All right. Hi, everyone. Can everyone hear me okay? Oh my gosh, it's such an honor to be here today in front of all of you amazing people doing this incredible work, and I'm just so honored to be moderating this panel in front of these amazing, wonderful folks doing just incredible work. So just want to say thank you and express gratitude first. I'll say just a piece about myself, I think, in terms of introductions, and then we'll do some introductions for the whole group. I guess the most important thing and job in my life is being a mother, right? So I am a mother of two. I have a 20-month-old and a 4-year-old, and I think I heard someone else say this before. I basically just serve them. Like, they are my boss, right? So it's just such a joy. As Dr. English had said, I am the Associate Administrator for Women's Services at the Substance Abuse Mental Health Services Administration, SAMHSA, which is a cross HHS role. We're really trying to bring light and continue to work with others in the space of maternal mental health and substance use. So I had a number of years, I'm a psychiatrist by training, a number of years where I worked in women's trauma and specifically perinatal trauma. So all of those stories, all of those patients are always with me and kind of driving this work. So just so honored to be here. I'd like to ask all of our panelists to give a couple minutes of introduction as well. So Nicole, we'll start with you.
Sure. Thank you, Nima. Good day, everyone. I'm Nicole Barnett. I'm a licensed clinical social worker and certified in perinatal mental health as by profession, but more importantly, I am a mom of 3. And after the birth of my 3rd daughter, I experienced postpartum depression and anxiety. And after my recovery, I began just sharing my story in a variety of platforms, whomever would listen, to just help raise awareness, most recently with HRSA for their Black Maternal Health Week campaign. But I have a special interest in communities of color, educating there, as well as in faith spaces. And I wrote a devotional book for moms of young children in which I included my story to help encourage moms of young children. In addition to that, my journey has led me to have the dream job of serving as a counselor for the National Maternal Mental Health Hotline, and currently serving on the National Maternal Mental Health Task Force that's helping to develop a federal strategy for addressing maternal mental health in this country. So I'm new to government spaces, but I'm really happy to be here today, and especially happy to be here with these amazing panelists.
Just incredible, incredible background. Bruce?
Hi, everyone. Good morning. I'm showing up super late, but nice to be here with you all. So glad I made it. But my name is Bruce McIntyre III. I am the founder of the Save a Rose Foundation. I founded Save a Rose after losing the love of my life, Amber Rose Isaac, back in April of 2020 due to medical negligence throughout her entire pregnancy. And what we do at Save a Rose is we aim to combat and dismantle the systemic flaws within the medical system and redirect the course of birth equity towards better birthing solutions. I'm also featured in the award-winning film Aftershock that's on Hulu. We were Emmy nominated in January. I've also been blessed enough to educate students throughout the U.S., medical students, residential learners, and I've also been blessed to influence policy change as well. So grateful to be here with you all.
Amazing. Alexia?
Good morning to also Hel from Philadelphia. Super excited to be here with everyone. Alexia Dumboya. I am a doula and the president of CocoLife.Black. Our organization started out of my own lived experience too, about 12 years ago, navigating mental health challenges that then I did not have the language for, didn't have the words to describe, and couldn't understand why at one of the most beautiful times in my life, I could not make a connection with my child and how disconnected I felt, and I know we'll talk more about it. But during that time, I had someone that saw me, that actually heard me. Unfortunately, it wasn't through the clinical setting, but it was a really close friend of mine that about 12 months postpartum said, okay, I think maybe you might want to have a conversation with someone. I'm a little concerned, and I want to make sure that you are good. So that led me down the journey of pursuing more education around becoming a doula and then getting certified in mental health awareness, and then finishing up my master's and focusing too on organizational structure and how can we build spaces that will help this to be seen, help Black women to be seen, and them to not go through the experiences that I had to. So I always say I decided to become what I didn't have as a doula. So thank you.
It's incredible backgrounds. And we're going to get into everyone's stories a little bit more, but I just want to preface this by saying just thank you so much for being up here to share your story. It takes a lot of courage to come up here and share that, publicly, and then also all of you are channeling that into helping others. So just want to preface it by saying that's so incredible, and we're just so excited to hear more about your backgrounds. So now we want to take a minute to, I know we kind of started this, but just take a minute to talk us through your specific journey of mental health challenges. So I guess we'll switch up the order. So Bruce, we'll start with you. Oh, could you talk us through your particular journey of mental health challenges?
So my particular journey in mental health challenges, of course, dealing with mental health is a struggle, especially whenever you're in a situation like mine, you lose your partner, you're having to raise your child, your surviving child as a single father. So, mental health really plays a really big part into it. But I was lucky that I had services and community available to me that did offer me these services that were, going to help me. Back when, Amber passed away, I was looking for services that were going to be available to me that would help me. We were speaking to the therapist that was directed to us by the hospital that Amber passed away in. And I just remember them, without even giving us the proper evaluations, they were so quick to try to throw drugs in our face, like Xanax and other stronger antidepressants. And I thought to myself, how am I supposed to take care of my newborn child if I'm doped up on these drugs and I'm left incompetent to take care of my child? So I knew that there had to be a better approach and a more holistic approach as well. And through the midwives in my community, through the doulas. They set me up with grief counseling programs that were very important to me, and it truly saved my life. You know, I was introduced to, you know, these different meditations and kriyas and breathing exercises that would help me with my anxiety. And, you know, it truly saved my life. So I'm very grateful for the women that I have in my community, the midwives, the doulas who did set that up for me. And they also, you know, did it out of love. I didn't have to pay a dime out of pocket. And, you know, that's what uplift in the community looks like. And I think that's very important.
That's a beautiful, beautiful thing. Thank you, Bruce. Alexia, would you want to share a bit more about your journey?
Yeah, so interestingly enough, I was thinking about kind of the space of mental health challenges and what it looks like for all of us. And so those challenges actually started for me, but I didn't reconcile it at the time when I was 10 years old. So I'm also a survivor of sexual assault. And it took a long time for me to even get to the place where I could say that. I had literally blocked it out of my mind like it didn't happen. And I remember being triggered in college one time, like that actually happened in reading a story. And so then now I'm pregnant, and I didn't think that there would be any correlation between the two. But I started noticing just feeling like I had been disempowered in the process. And I'm reading these stories and these books and, you know, watching these shows about all these other people who are really excited about being pregnant and who are having these great experiences, and that wasn't mine. And so then you kind of go through this grieving process even then of the pregnancy or the experience you thought you would have. And now these intrusive thoughts are creeping up from the past too. And I also experienced a loss, and so I'm on eggshells with this pregnancy as well. And there was just nothing really to kind of help me reconcile. Fortunately, in my family, we like many Black families, had one of those, what happens here stays here. We don't talk about things. We just kind of push them way down and keep pressing on. And I had done a really, really good job of creating this mask that was very beautiful. And I wore it for years of suppressing the anxiety, the depression. But one of the things that happens, like grief in other places, I could not run from it in pregnancy. I couldn't control it. My education didn't help me. My advanced position as an executive in the workforce couldn't help me. Nothing could really prevent me from dealing with it. And so after having my daughter, and again, as I'm also navigating a divorce at that time too, just the support just seemed to be unraveling. And I heard someone use this example yesterday. It was like a sweater when you find a thread and it just kept unraveling, and I felt like I could not stop the bleeding. So it's like you're suffocating, and I didn't want to do it in silence, but that seemed to be the only way, because where do you go? Because one of the things I had also seen is that if you share your story as a Black mom, there's a possibility between family surveillance that I could lose my child too, and I just didn't want to chance that because I knew I needed to take care of her, but I wasn't sure if I was the best person for it. And so it saved my life for someone, again, a friend of mine who is a social worker as well, who stepped in and said, you know, let's explore what some of these options could be, because it wasn't prevalent. It wasn't shared with me in my postpartum visits or those prenatal visits. You know, you take the little screening and you go through the checklist, and I tried to answer it as transparently as possible. But still, there wasn't anything done. A lot of it was met with kind of being dismissed and just medication. You know, that was definitely something that was prescribed. And so as time went on with my second pregnancy, I was blessed enough to get pregnant again. But then that experience came shortly after burying my mother and my father-in-law. And so even then, just understanding the importance of handling your experiences that you have so they don't feed into and flow into the next evolution of life and what happened in that journey. And so that time I tried. I said, okay, I'm gonna be more vocal with my clinicians, and I'm gonna tell them about the experiences I'm having, the pain that I'm having emotionally and physically. And I remember one of the clinicians at a practice, she said to me, she was like, well, that's just a part of being pregnant, as she walked out the room and closed the door. And I remember sitting there like, okay, here I am trying to be more transparent, and unfortunately, there's this door closure. So what do? what do you do in those positions? And I thank God for keeping me and not choosing to go a more fatal approach and something that you can't return back from. But I can't stress enough, like, just the reminder that I learned along this path of making sure that you address the challenges that you have, that you seek support. Even sometimes you might have an inkling, you may not, that there is something wrong, but keeping people close to you. So I'm really big on community in the village, because they will see things, like Bruce just said, they will see things that maybe you don't see and help to give you those solutions that'll work best.
Wow. I'm going to save comments for a little bit for the end. I know we also have Q&A. I have so much to say after each of your stories, but for the sake of time, just incredible. Nicole, would you be able to share some of your journey?
Sure, I'm happy to share my journey. I would say my maternal mental health journey began about 3 months after the birth of my third daughter. And I really consider myself quite fortunate in that it was the birth of my third child, and so I already had an idea of what my postpartum experience should be like. And I could tell about 3 months out that it was not what it had been for the other two. Really had a classic case of depression and anxiety. I had an overwhelming feeling of sadness. It felt like my mind was just in the clouds. A phrase I like to say is like my brain just wasn't cooperating with my life. And I wasn't necessarily sad about being a mother. It just was confusing me why I was having such a hard time. I would be completely fatigued and just overwhelmed, even after getting much sleep. Would wake up and feel like a truck had just hit me, and nothing seemed to be able to break it. And so when I knew that that wasn't quite right, I finally reached out to my obstetrician's office, and I had a really great experience in that regard. The nurse that answered the phone, she told me right away, it sounds like you have a touch of postpartum depression. Why don't you come into the office and we'll see if we can give you something for that. Well, I was a clinical social worker, so I knew to some degree what that was, and I did not want to hear that label. I did not want to hear the words postpartum depression. To me, at that moment, it sounded like failure mom, and I just did not want to receive that. In addition, I also had concerns about taking antidepressant medication while I was breastfeeding. I was breastfeeding my daughter and very dedicated to that, and I just wasn't sure how it was going to impact her. And something I like to share is that when you're talking to your doctor, when you're reaching out for help, something I think important for folks to know is if you really are suffering from depression and anxiety, your brain kind of isn't working the way that it normally should work. And so even practical advice doesn't sound like the best advice. So, taking medication for me now sounds like a no-brainer, but at the time it was like, no, I'm gonna be in the 1% where my baby turns green and, like something's gonna happen and it's gonna be a really bad outcome. And so I spiraled down over a 3-month period trying to explore and research and trying different things, taking iron to see if my iron was low, taking, other things, but I didn't want to accept the postpartum depression. And it finally got to the place where I was fearful that my children were going to be harmed by neglect because I simply wasn't monitoring them and watching them as I should. At my worst, I remember taking a baby gate and just gating myself off in a back room with the children. I would give something to the 5- and 3-year-old and they play and just hold my baby and just pray for my husband to get home. And when he would get home, I would hand him the baby and I would go and disappear. But it soon became clear that it just wasn't sustainable. I talked with my husband, and we made the decision for me to try the medication, which was helpful for me. One of the things that helped with that is that the nurse explained to me that it wasn't going to make me feel a false sense of happiness, that it was just going to sort of get me back on an even keel. And that worked for me. That's not necessarily needed in every particular person's case, as has been said here. But once I got to that even keel, I was ready to do the individual therapy, and the intervention that helped me the most was a support group that was run by an incredible woman. She's a leader in the field now, Adrienne Griffin. And even though that support group was almost an hour away from me, and even though when I got there were no women who looked like me, we still were able to bond over what we had gone through, and that helped me the most. And after I recovered, I started sharing my story and started seeing that, especially in faith spaces, that oftentimes mental health issues are over-spiritualized or seen as not being strong enough in your faith. And I knew that I had to do something to start trying to educate in faith communities and with women of color. So that was my journey.
Okay, wow, just incredible. Thank you all so much for sharing that. I think you've really highlighted the importance of holistic care, community support. And honestly, I wish everyone who starts training in OBGYN or just any kind of healthcare training gets to hear this right at the beginning. Like, I think of all the students that we work with, and I think, this is what they need to hear first. So hopefully with our roles, we could try to do more to reinforce that, but just want to really thank you. Incredible stories. So with these backgrounds, we now just want to hear a little bit more about where, with those particular challenges, where has that led you? What path has that led you towards in terms of whether that was, what you're doing now or kind of the path you took right after that, up until now? So we'll open it up for anyone that might want to answer first.
Yeah, I can start. So my background at the time had been in the for-profit space or organizational leadership, particularly working in health insurance companies. And so some of what I then started to see on that side, kind of like on the MCO side, was a lot of insureds that were struggling to meet co-pays, to have services even that they really needed be accessible to them. And as I transitioned from that space more into the maternal space, I wanted to be one of the service providers and kind of help to advocate for those who needed more support. And that was where Cocoa Life birthed from. So we support moms in three key stages of pregnancy, postpartum, and compassion for the loss of a child is how we initially started. Then one of our founding members lost her husband when she was 7 months pregnant. And we quickly realized, too, that it's important to also be able to provide support for those who experience the loss of a significant loved one. And how do you build that community and village there to make sure, because there is this child and this other parent that still needs that support as we go on. And so we provide free doula services, and that led and free mental health services and connection to our community that way. But one of the things that we always talk about is we are moving in a community empowered model of care. We recognize that in the Black community, again, we have been so disempowered that it's like, how do we get back to a space of community and encouragement and excitement about birthing joy? We know what the data show, but we also wanted to make sure that we can connect people with the resources prenatally through postpartum, and not just those first few weeks, but all the way through the journey. I have a 5-year-old junior intern, or going on 5-year-old junior intern, and I still feel like I'm just now kind of reconnecting back. And so that was one of the things. So it was community building the support groups, and our Perinatal Health Equity Academy, which was the space of working together to bring other people who want to come into this space as a doula or who want to join in that movement of being a mombassador, we call them. How can we do that together? So we work with organizations that are dad-centered as well. Even on some of what I know will be talked about today, a National Tour of the Moms Tour, we also provide the doula support there as it relates to access to the space, connecting with amazing other organizations. We've been able to do that across the country, and I think that's one of the things that we really wanted to reinforce. By nature, I'm a connector, I'm a collaborator, I love working with people, and I have to say too, just being able to be embraced coming into this community, because I had a lot of intrusive thoughts there and suffered from, this was not my zone of genius, as one of my good friends says, so how is this going to be me transitioning from this world that I know so well and was so comfortable here? But everyone, every doula I met, every midwife I met, every family I met, kind of met the excitement and the energy and the passion that I had with that same. And hey, however we can support you, that's what we want to do. So I think that's where the journey has led, is to take the pain and turn it into purpose in this community space.
It's amazingly beautiful. Wow, just incredible. Yeah, incredible work. So amazing to see. Would anyone else like to go next?
Yeah, if I could just follow up, and how it's helped me along the way as well is it's allowed me to really take a step back and really tone in on my triggers and my traumas and things like that, and how to identify it, and how to, allow myself to be vulnerable. As an introvert, that was really hard for me, to have to, be an extrovert and allow myself to be vulnerable. But I've realized so much power that lies within that vulnerability. It's allowed for me to create safe spaces for other people who need that safe space, who want to talk about their emotions, their feelings, their mental health, depression. And so, yeah, I'm grateful that I'm in the position to do so now, and that this has helped me along the way so I can help others. Now we're seeing more fathers speaking out. We're seeing a lot more fathers speaking out and talking about their feelings and being vulnerable. And just letting men and teaching men that it's okay to be vulnerable has been everything to me. But I'm grateful to be in a position to be able to speak to these gentlemen, speak to men, women, just by sharing my story and being vulnerable with them. Allows them to, let their guards down and be vulnerable as well. And I just hope that continues to inspire others to do the same.
I'm going to steal that power and vulnerability phrase. Oh my gosh, so incredible and so true. And I've never actually heard it framed that way, and it's just incredible and so true. So again, amazing work. I know I keep saying this, it's just incredible to hear y'all's stories. Nicole.
Sure. I would say, where my journey has led me is realizing the importance of doing the work on both ends. And when I say that, I mean, in one stance, we're reaching one person at a time. We're reaching one mom at a time, one family at a time. Even when I share my story, I will say if just one person goes and gets an evaluation, if just one person reaches out for help, then it's worth it. And even in my one-personness, I can remember when I started doing education, when I went to one of the hospitals I went to, it was a labor and delivery unit. And the labor and delivery nurse, one of them came up to me at the end and she said, I've been an L&D nurse for 40 years. I've never heard of anything that you just talked about. And that just really struck me. But it also makes me sad that I saw an article that was dated 2020, and it was an obstetrician who had gone through postpartum anxiety, and she herself did not know what that was because she hadn't received the training. And so just helping one person at a time. In my faith spaces, the women in my church, people know my story and have become more open in talking about mental health. They'll call me if they feel like someone might be struggling. So I've loved that, helping one at a time. But now on the end of working for the hotline and serving on the task force, I'm seeing the importance of just taking that lived experience, people who have that lived experience, and putting them on the end where it can help many, many more. And so I value that is being centered in a lot of spaces, just lived experience, even in you having us here on this panel now, opening things up. And so I've loved the journey of helping one woman at a time, and that's worth it to me. But I'm also loving the journey of being in spaces to talk with people that have the power to make our experiences different, because we can become aware. I can do all the prevention and education and awareness that I can do. But if a woman or family actually gets to services and gets help, and those people don't help her, we can't win. We can't do it just by being aware. It takes all of it working together so that we can really stop this horrible trend of Black women being 3 to 4 times more likely to die in childbirth. So it's worth it, helping one at a time, but also knowing there's big work to do as well.
Oh my gosh, just incredible. Thank you all so much for, seriously, round of applause. Thank you all so much for the work that you're doing. And it just speaks, as I think being a parent or having gone through some type of trauma, it just helps you, one person to another, helping each other, like do that peer support and community support, helps heal in a way that's not possible in the medical realm. Like it's that type of healing just doesn't occur in those spaces, no matter how hard providers try. It's not, it's a gap that's filled in the community with, one person to another. So you're all doing that work. It's just incredible, really. So I think you all have touched on this, but if you could expand a little bit on and telling us a little bit more about your journey towards healing. So we heard about, the challenges, the traumas that you've experienced, what you've done, how you've channeled them. And can you tell us more now about healing and that process? So we'll open it up.
So yeah, the journey towards healing it's been a journey. It is a journey. Every day it's a journey. But I hear a lot of people ask me, Bruce, how are you able to share your story so many times? Like, where are you finding the strength from? And I tell them this is a testament to my love for Amber, and this is the strength of Amber. She, before her passing, she was, always speaking positive affirmations to me, always building me up. And so even after her passing, I kept that with me. I could still hear her, trying to push me to do better. And I want to honor that as well. So yeah, a lot of people ask me, Bruce, how are you able to, I've shared my story, I feel thousands of times for the past going on 4 years. And it never gets easier. It gets tough. There are times where, I'm sharing a story and I might need to stop and break down and cry for 5 minutes, but I'm going to allow myself to do that. That's not something that I'm going to let hold in. Like if I sit here and cry, you're going to sit here and wait. and let me get it out. Real unapologetic, because, I realize that I have to sit with those feelings and I have to feel that. And it's also been healing for me to share her story. Sharing her story, who she was, who she is, what she's contributed to the world, what she's contributed to me, my son, our family, our community. And it helps to know that she has been a martyr for change. She's changing the systems. The strength that she's given me has allowed me to do this work. And, doing this work has allowed me to, like I mentioned, identify my triggers, my traumas, really sit with those emotions and, move through those emotions, whether they be good feelings, bad feelings, sad feelings. Those are something that we really need to sit with and let it marinate. And, but yeah, I think that also seeing all of the change that's been happening in her honor has also been very healing for me. And to see that her life has been saving the lives of millions has also been very healing.
It's incredible.
I think healing for me on this side has definitely looked like doing the work. So seeking those holistic approaches, therapy, and things like that. What I've also been so encouraged by are stories like this, stories like Bruce and Amber's and Omari's, and just countless stories that in my own, honestly, and using that as a platform to encourage others. As we started last year, I met some amazing women and men last year when we started this journey of the Moms Tour. And even through, I was encouraged by one of my friends, Latoya, who talked about the connection that she made to realizing her connection to the maternal health experience, not even realizing that she was a part of this journey. She was the data, because we talk so much about the numbers. We say the numbers over and over again ad nauseum, important, but when you see the faces that go along with these numbers, it flips the whole game. It changes things. And so healing for me has absolutely been like holding a mirror up, seeing myself, acknowledging those things that are triggering to the trauma that I've had, being able to live for my mother who couldn't speak for herself through her birth trauma, my grandmother who couldn't speak for herself, and then it also encouraged me to learn more about my own family history. So understanding when you find out and you go through your lineage and learning that I had midwives that I'm a descendant of, and learning that there were people in my family that did the very things that now we're doing in this more modernized way. But if we could could get back to community, if we can get back to talking, when we say about the village being the people that are encouraging the village, we will see change. And I do agree that our providers can make a connection to this work when they deal with their trauma, when they address some of the challenges too that are facing the systemic issues, and how to break free from being a part of those shackles. So I think spaces like this are healing. Being able to be seen is so important. Making sure that our dads are not underrepresented, because they are very, very present, and our partners, and just building, continuing again to make sure that everyone knows that there is a space for you here. I think that's where I find value in healing in. Belonging, I think, is kind of the biggest piece, and knowing that even through these challenges that we have, if we continue to do this work together and keep creating space for each other to be our best, then we can lead more boldly in our lane, and we'll be able to keep seeing some of these changes. There's a song, faith-based song that talks about, if I can help someone along this journey in whatever way, a song, then my living is not in vain. So we don't want Amber's passing to be in vain, and we don't want our living to be in vain. So we have to look at communal healing in that way.
It's incredible. I love that you said healing is belonging. I mean, that's just such an incredible way of phrasing it. And I always tell folks, when we experience trauma, one of the first things that happens is we have a sense of uprootedness, right? We feel uprooted, we lose agency. And I think that is the hardest part, and the healing process starts with that re-empowerment. So you just demonstrated that so beautifully. Nicole.
Yeah, in terms of healing, I think I noted earlier that I really felt like my support group was one of the most healing parts for me in my journey. Similar, helping others has been a wonderful form of healing. I can remember being called for a woman in our church by some friends, and they knew of a mom who was about to drive off a bridge with her children. And just to be able to go and help her, that just brings purpose. But also, I guess a sense of healing for me has been to been able to reconcile parts of your life with mental health. And so for me, because that was big in faith spaces, to be able to reconcile that together and help educate others is simply, I will often say, you can have your faith in a therapist too. Like, they don't have to they don't have to be opposite things. So reconciling things in your life through this process has been healing for me.
Amazing. Thank you all so much. Just a round of applause for all of them. It's incredible. Well, I was going to cover a couple of things the administration is doing, but I think it's more important to hear from you all around your recommendations for other folks that are going through similar struggles as you. And I think we're going to be covering enough of what the administration is doing. I think Karen and Dr. English did cover that too as well. So please, if anyone could tell us what your recommendations might be to someone out there who might be experiencing similar struggles.
I'll start first. I definitely will just always tell women, especially women of color, any woman for that matter, to not let the stigma of any mental health type of label keep you from reaching out for help. In my case, medication was a part of it, but oftentimes we know in this field that medication alone isn't the answer. And so you can pursue other methods. You can get in counseling. You can find a support group. And just simply not letting, that label, that stigma, keep you from reaching out. Because if you don't do anything, you're only hoping for things to get better. When you take a first step to do one thing, then you're actually helping things to get better.
That's beautifully said. Absolutely.
If I could just add on, I would just say, finding your community, whether it be faith-based, whether it be a fatherhood program. I'm in a program now with Omar Maynard called the Luxor Collective, where every 2 weeks, us men, we get together from around the U.S. on a virtual call. Sometimes we'll try to link up whenever we get the chance, but on virtual calls, we'll talk every 2 weeks about parenting. And a lot of these fathers are people who've experienced grief like mine. Whether they've lost a partner, whether they've lost a child. And we talk about those things. We talk about our emotions, our feelings, our parenting methods, all types of things. So I think really having a group like that is very important. So really just finding your community, finding those people that are going to uplift you, not being afraid to speak out, allowing yourself to be vulnerable, is truly, like I mentioned before, there's a lot of power that lies inside of that.
Absolutely. Wonderfully said.
And I'll just quickly ditto, and I'm going to talk to the community, faith-based leaders, providers again. Please don't make us have to do that, them have to do that. So it is great for us to be empowered and to be able to have agency and seek those services. But if you see something, say something. You know how we say that, like pay attention. I think as a society, but whether it's technology, whatever, you even look at the home building of structures, there's no porches in the front of the homes as much anymore. We have more patios and backyards. And so that whole sip my tea and mind my business doesn't work for solutioning things. So I would just say pay attention to the resources that are offered by the federal and then your community-based organizations, and then share them. If you see moms and families, dads, offer to support them, offer to help, and don't just wait for them to come to you if you can be that bridge for them. For all of us, that's a message for all of us.
Oh my gosh, well, I feel like we could have talked all day. I'll be reaching out to you all. Just incredible stories. Thank you so much for coming and sharing your story and just being, like you said, vulnerable, open in this space. I just want to give a round of applause for them. Thank you so much.
Thank you. One more time. They were so incredible. Thank you for allowing us into your space, your vulnerability, for the purpose of helping us do better. I appreciate that. And when you were talking today just now, my head was all over the place when I think about Black people don't handle grief well. Am I right? I know I'm talking to my fellow people of color out there. We need to be able to normalize grief dialogue in Black communities. I'm going to say it again. We need to be able to normalize grief dialogue in our Black communities. No longer what goes on in the house stays in the house. Some things need to come out of the house. And to that end, I want to acknowledge Raul Andrew Jr. Would you stand? And Amy Porfini. They're the ones that honored us with some beautiful, delicious breakfast. But they're with the American Psychiatric Association Foundation, and they left some information for you for their Mental Health Care Works movement out in the front. So please avail yourself to that. And then lastly, I want to announce that we just hot off the press came out with the Partnership Center, very own National Faith and Action Guide on maternal health, giving you practical steps on what you can do in your own community, on a community level, to improve maternal health outcomes. To that end, I am very pleased to bring up Dr. Phyllis Dinnery, who's going to be talking to us on the landscape of maternal and infant health, a March of Dimes perspective. She is a board member of March of Dimes, and she's the chair of pediatrics at Brown University and pediatrician in chief at Hasbro Children's Hospital. Let's give her a hand as she comes.
Thank you so much, Q. That's great to be here. And those stories are so moving and bring us back to experiences. I'm the mother of 2 premature infants, and those are tough times. So I'm not sure who does the slide. Oh, there we go. So I'm here. I'm going to be factual here and give you a bunch of facts, but then give you some of the solutions that the March of Dimes has worked on. So first of all, what's the March of Dimes? So I serve as the vice chair of the Board of Trustees and also the chair of the Advocacy and Mission Committee. So the March of Dimes, it started in a very different place. Franklin Delano Roosevelt founded this as a response to polio, because at the time kids were dying of polio and there was no vaccine. So the March of Dimes funded support through crowdsourcing, really, through crowdfunding, because he asked all Americans to send dimes in through the mail to support this work that Dr. Salk did in terms of discovering the vaccine. And so that was a big accomplishment, and that led to the name March of Dimes because of that. And after that, many other steps were taken, including important things like the folic acid campaign to prevent neural tube defects, and surfactant therapy to help premature babies breathe, and others more now the space of NICU family support groups for babies who are born premature and their families. And also, right now we're at the space where we're really focusing on addressing the health equity issues and narrowing the equity gap so that we can all have healthy mothers and babies, which is the most important thing. Unfortunately, the statistics are really dire. The U.S. is one of the most dangerous places to have a baby in developed nations. You'd think we're ahead of things, but we are not. 2 women will die every day from pregnancy complications, and 2 babies will die every hour. So that's even more depressing to think about. And that's because there's been a trend, which is a sad trend, towards reversal of maternal mortality statistics. We thought we were going to do better, and now we're doing worse. In 1991, we were 10 per 100,000 live births, and now we're at almost 24 per 100,000 live births. That's as of 2014, for example, that's statistics. But more than 22,000 babies die in the U.S. before their first birthday. So that doesn't sound right, does it? I mean, we shouldn't be in this space because we should be an advanced nation with all sorts of positive statistics, not negative. And what's even more challenging is that this is a problem that affects Black mothers and brown mothers. And what is the issue is that we are more likely to die and experience severe pregnancy complications than others. And we're also more likely to die from those complications, and the babies are more likely to be premature. That's really sad information, but it's true. And there's been an increase, it's not a decrease, there's been an increase in Black maternal death over the course of the last years, and preterm rates in Black women are extremely high. They're 50% higher than in other mothers. So at the crux of this is possibly this, which is that there's too few OB providers. The problem is that in many counties, so the green, the dark green space that you see there, this pointer doesn't work, but anyway, the dark band in the middle of the country is a place where no OB providers are. There's none, not one. And if you look at the other spaces, even in the Northeast where we are, there are still areas that are maternity health care deserts. So up to almost 50% of all counties in the U.S. don't have a provider to care for these mothers. Now, it's obviously very important that mothers go see their obstetricians and get care so that they can prevent poor outcomes of pregnancy, right? And this is another problem. Not only are there no providers, there's no hospital. So these the same dark swath in the middle is where there's no hospitals or birthing centers. It's been a problem that's evolving because even before the pandemic, these centers were closing because there's some disincentives to being there. There's some struggles. It's hard to keep up with staff and volume, et cetera. And therefore, that makes it very difficult to care for mothers. And in rural counties, this is a real problem, even more so. If you have to travel for care for a regular, normal pregnancy, traveling for care when you are facing a pregnancy that is high risk is even more challenging. So we do see that, again, many women have to travel outside of their county in order to get the appropriate care that they need. And that's really tragic because I'm sure you've seen some of those stories where women deliver on the side of the road trying to get to care. And this is we've come a long way. We shouldn't be there. And another issue is many women still don't have access to health insurance. A lot of women who are underserved are on Medicaid. And if you notice, in some states, it's dark red, meaning that a lot of women, up to 40% of women, don't have adequate health insurance. So how can they take care of the needs of their family and of the baby that will come? So thankfully, there are solutions. And you've heard from the folks who talked before the very poignant stories about mental health and the challenges in pregnancy, and also the solutions and the things that they have done in order to combat these challenges that contribute to this huge problem that we see. The March of Dimes is focused on 4 areas. So we do support research. We have premature research centers. We have a center at the University of Pennsylvania, Research Center for Advancing Maternal Health Equity, focused specifically on health equity. And then we also do research by providing those reports that I showed you, the Maternity Care Desert Report, the Prematurity Report Card. Those are reports that tell us what's happening year to year in this country and keep us aware of the challenges that are there so that actions can be taken. Some of the programs that we do, supportive pregnancy care programs, NICU family support, which is something that's been in some of your hospitals and helps families that have premature babies get the support they need in these difficult times. And then I'll talk a little bit later about the mobile health centers. Also, we spend a lot of time advocating. We go to the Hill, and we have our great representatives here who go and advocate for better health, for better support for mothers. The Preemie Act was passed, and that, strangely enough, had lapsed, but was re-upped, and now it's passed, which will give research dollars to support research on prematurity, paid medical leave for families, and that's very important when you are delivering. You need to have time with the baby, and protection for pregnant women. One of the things we also do is educate. We educate on implicit bias training, because a lot of this is about racial inequities and disparities. So if you think about that, we have, we talked about the challenges that Black mothers face. That's not a genetic problem. That's none of that. Race is a social construct, and the fact that we are suffering these consequences has to do with racism more so than anything. And NICU family support care and other sorts of educational opportunities to help people learn more and to help people create solutions as well. And we want to partner with people to do critical work and to work with others who are equally invested in this space. We facilitate the Mom and Baby Action Network, and we do, and that's a consortium of over 400 partners that look at local and state levels to look at ways in which to collaborate to really work against these challenges that are faced. We work with CVS Foundation as well to raise awareness about doulas. We've heard from doulas, and we're very much in favor of doulas, and we support doulas, and advocating for growth of the doula workforce and not having mothers pay out of pocket for doula care. We do work with the Kellogg Foundation to look at midwifery as well. We haven't had a chance to talk about that, but supporting and paying for and allowing for midwives to be part of the care system. If there are not enough OBGYNs, there probably are others who can certainly support the care of the mothers. And lastly, I'll just talk a little bit about the mobile health center. So the mobile health center is, there are vans that go out in the communities that allow for care for prenatal, postnatal, and care for various, in various regions, including Washington, D.C., New York. And you wouldn't think of those places as maternity health deserts, but there are some places where it's hard to access care. So this supports the community. And if you want to hear more about that, mobile health at marchofdimes.org is the place to reach out. So I'm really blessed to be part of this great organization to help fight for the health of mothers and babies and to align with partners like yourselves. And I look forward to hearing more today and hopefully coming with better solutions to protect our mothers and babies. And thank you for your time.
Thank you, Dr. Dinnery. And if you have not connected or collaborated with March of Dimes, please do so. And when we have that networking mixer, please take time to just partner with those that you're hearing. Last year, I shared with those that are speaking this year, we had some incredible testimonies of people doing more work as a result of us coming together. That's why these time together is critical, but we have to be action-oriented. I want to take a moment. Can we just put our hands together for the support system of doulas and midwives? And you all know that we're doing incredible work in that space, and they're appreciated, they're needed, it's been proven. And when we heard today, even Bruce said that was his healing line. Let's remember to do more for them. And oh, one more point. We have now on the Moms Tour, because of Alexia Dumbuya, could you stand one more time, Alexia, who has now certified close to or over 200 culturally competent African American doulas in our nation. And she continues to do the work. And on the Moms Tour this year, we're hoping to be able to triple those numbers as we're targeting 25 cities that have high maternal mortality and morbidity rates. Next, we're going to have our keynote speaker who came into an unfortunate circumstance, actually ended up in an Uber accident, but she is doing just fine. And she said, can you please, anyway, get me on video, Zoom? I want to be here with you. And so to that end, I am pleased to introduce Kimberly Seals Allers, the creator of the Earth app. They're clapping for you, Kimberly.
I feel it. I feel it. Good morning, everyone, and thank you so much for this opportunity. Much gratitude to Dr. English. Apologies that I could not be there with you in person. I made great efforts, but somehow life was lifing. So I am very grateful, one, to be safe and sound, but two, to be able to use technology to be with you virtually this morning. And so for my brief remarks today, and for this powerful session that will continue on, I want to offer you an interesting framework for this. And that framework is, whatever the question, the answer is in the community, right? Whatever the question, the answer is in the community. Now, I know that in many worlds, we have looked for answers in medical journals and academics and research and all these things, which are very important. But I'm going to ask you to consider the framework, whatever the question, the answers in the community, right? Because quite frankly, we have done all the research. We have done all the data that we actually need if we truly cared about this issue and had the will to address it. We have done all the acts of problematizing Black women, saying that this issue was rooted in us not getting prenatal care or pre-existing conditions. We're overweight, we have high blood pressure, we got diabetes. We've done that, right? We've done acting as if this is a socioeconomic issue when we know that it is not. Right? We know that across socioeconomics, the data is actually showing that regardless of income or class, that Black women who are earning six figures are still at a higher risk, and their babies are at a higher risk of dying than a white woman who did not graduate high school. So we've done that. We've done all of that. We've done sidestepping the uncomfortable conversation, but necessary conversation about the impact of bias and racism in care. So we have done that, and we are done with that, right? So this is where we're at today. In my work for the past 12 years, working on the ground in various cities, starting from Birmingham, Alabama, Jackson, Mississippi, New Orleans, moving through projects through Philadelphia, Detroit, there was one thing that was very clear to me in all of these conversations where I was have. And my work was about lifting up community voices as a tool for birth and breastfeeding equity and justice. Now, just as a level set, I come to this work as a journalist by trade. I don't have a public health background. I'm a former senior editor at Essence magazine, a writer at Fortune magazine, worked extensively in newspapers here and abroad. And so asking questions is something that I'm trained to do. And asking them from the point of not knowing but seeking answers is also part of my training. Plus, I'm a storyteller by passion, right? And so really this idea that our stories have power, and that actually, if we listen to the community, we will have new insights. Really, really important that we take that on. So as I was doing this work for the past 12 years on the ground, literally knocking on doors in communities that were most burdened by issues of maternal and infant health disparities, there were about three threads that became very apparent to me. One was that I was hearing the same story, whether I was in Detroit or New Orleans or Oakland or wherever, that Black women were being disrespected, treated harshly, that they were being ignored around the things that they were saying, that they were dying and nearly dying at disproportionate levels. But there was no way at that time for my sister in New Orleans to know, I just heard the same story in Detroit, and I just heard the same thing in Philadelphia, right? Thread number one. Thread number two, the doulas always knew. In every city that I worked in, it was the doulas who were like, no, you don't want to go there, go there. No, 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 you don't want to go to him or her, go there. And it was like the Underground Railroad for birth. And so I was clear that there were gatekeepers. There were those who knew about safety, but how could we bring that knowledge to the community level and not leave it just at the doula and client level? The third thread was that the narrative that was existing in Black maternal health was becoming too weary. I started writing about this back in 2018, that I was concerned that the doom and gloom approach with highly sensationalized headlines about Black women dying, every story is about negative statistics, our despair, our demise, everything. That actually this was becoming a problem. And awareness, yes, but awareness at what cost to our community, right? Three very important questions that we must always answer. Today, my work as the executive director and founder of Narrative Nation, we are a media and technology nonprofit based in New York City. We work on two key strategies and two key significant products. All of them are rooted in the power of our voices and in the power of our stories. I'll start with Birthright, a podcast where I only share joyful Black birthing stories. We need to understand that joy is a metric, and that not to whitewash the realities of birthing when you are in a Black body, but to say that it can happen not because of the system, but in spite of the system. And we can learn from that too. At the end of season 2, we actually brought in a team of qualitative researchers who analyzed our transcripts of the Birthright podcast, who looked at it, and I gave them a mandate. What could doctors and nurses learn from Black birthing joy? Something they've never been asked to do. And so what we created was a 90-minute instructional interactive session. I am proud that we are taking that session to grand rounds and medical schools and really creating a new way of learning about Black maternal inequities through positive experiences, to never forget that joy is our birthright. In the Birthright podcast, we have 2 key episodes. One where we are sharing these positive birth stories, bringing in others who are involved in that, whether that's the doula, the OBGYN, the partner, the dads. Really proud of the way that we've been lifting up fathers' voices on the podcast. And then the other, so germane to the panel we saw earlier today, is the restoration episode, where we take folks who have experienced some form of trauma and we sit them with a perinatal mental health therapist and we take them on a healing journey. Because I've been saying, we may not be able to prevent all the harm right now, but we can help people heal. And let me tell you, my friends, our community needs healing, right? There's a whole spectrum of trauma that's being discounted and ignored if we're only looking at mortality and morbidity. Just because we didn't die doesn't mean we have the experience we deserve. And that brings me to the work that we do with the Earth app. And I was proud to see one of my sisters on the stage with her Earth app pin. Thank you so much. Earth, which is like the word birth, but we dropped the B for bias, so it's IRTH, is the first of its kind Yelp-like app designed just for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. We are all about crowdsourcing and publicly sharing where we're getting good care and where we are not. On the back end, we turn these reviews into data to work directly with hospitals, payers, providers, so that they could learn from the lived experience of Black and brown birthing people instead of waiting for another tragic maternal death and preventable maternal death to recognize that there may be gaps in their care or bias on their teams. It is not lost on me as we kick off Black Maternal Health Week that my parents and grandparents literally needed tools to travel safely. Right? They literally needed tools to know where they could go, what hotels, what gas stations they could travel in. And so for me, Earth is our digital green book. It is our way to use community to crowdsource and publicly help us figure out where we should go to birth safely. Very important. And technology allows us to leverage the collective power that we know is in our community and use it for change. Now, what I learned was that health systems simply don't have enough patient experience data. Response rates to HCAHPS, Press Ganey's, all the hospital administered surveys are declining, particularly from Black folks and other people of color. Why is that? Earned distrust. And I remind folks that it was earned. Okay, so here we have health systems, we'll give them the credit, wanting to do better, focus only on having not enough patient experience data, focus only on clinical outcomes, thinking that if we don't die, nearly die, or hemorrhage, that they are doing okay, but not having enough quality and robust patient experience data to bring together. And this is the gap that we fill. Because if the community has a trusted resource, they will share. Our community tells us they don't respond to those surveys. They don't know where they're going. They don't know if anyone reads them and what's the point. We're all busy. And they don't know if they're being tracked. In 2024, where everything is tracked, they have to return to these health systems to take care of themselves and their children. And so they simply don't respond. And as I tell hospitals, and I will say it again, just because you didn't kill us doesn't mean we had the experience that we deserve. And so at Earth, we are all about, one, driving transparency as the way forward. Because as I let hospitals and health systems know, the reason folks are not responding to your surveys, even when they're asking great questions, is that lack of trust. And in any relationship where trust has been broken, somebody's going to have to be transparent. And I'm going to let all the people in relationships in the audience give me a cosign on that. Somebody's going to have to be transparent to repair a relationship. And so we offer health systems a tool and an opportunity to actually repair their relationship with community by going through our process. The Earth Hospital Improvement Program is now being activated in 8 states. We're working with 7 health systems, including our 3-year project in California, where we have 2 hospitals in the LA area, UC Davis Medical Center in Sacramento, both public health departments in San Francisco and Alameda County. We're working in Detroit. We have a hospital partner in Philadelphia, here in New York City, where we are also providing data to a city collaborative of 23 32 birthing hospitals with the New York City Health Department. So we work directly with hospitals, taking them through our 18-month to 2-year improvement project, where we literally collect data in their community. We create actionable strategies based on what that community says matters to them, and then we move them forward. We are very proud of this work, but we see transparency and accountability as the only way forward. And our last strategy is around narrative shift, reframing our experience in this space. I love the language of Dr. Farrington from the Coalition of Safe Black Motherhood, who reminds us that we are not in a Black maternal health crisis. We are in a crisis of obstetric violence. So let's get our language understanding that it is not that we are in a health issue. We are in a treatment issue. How we are being treated is in a crisis state. And so in our work, joy is our metric. Our experience is the outcome, is a very important outcome. So as we continue on today, yes, to keeping hope alive. Our hope, and in that space, our hope is community-centered. Our hope is community-driven. Our hope is rooted in transparency and accountability as the only way forward to birth equity and justice. And that hope is inextricably linked to the power of our stories and our collective power as Black people. With that,
Wow, thank you. Powerful, powerful, powerful. Powerful, powerful, powerful. Joy is a birthright. Tweet, I forgot to mention, if you're tweeting, please tag us at HHS Partnerships. HHS Partnerships, that was powerful. Joy is a birthright. That's why we named it what we did. Keeping hope alive. Even in the midst of all the dismal stats, we have to keep hope alive. And I always say, as long as there's breath, there's hope. And so we're about to be joined by our members, and I want you to be taking down questions because we are going to have time for interaction. Even though you don't see it clearly on the agenda, we will have time for interaction, questions, and some thoughts as you hear from some of the other speakers. At this time, why don't we just take time to break? Don't go too far because the members are coming in, and you should be pretty much steady in your seat if you can. But don't go too far. They're going to come in and start doing some meeting and greeting with you. And do connect now with the speakers that you've already heard from. And download the Earth app. Thank you.
Produced by the U.S. Department of Health and Human Services.